Good afternoon. This is Gail Hoxter, Chair of the Healthy Food Systems Priority Group, and just doing a sound check, make sure everyone can hear.
I can hear you.
Okay, terrific. I want to say welcome to everyone. It's exciting to see over almost 40 again for our second webinar. These are the Public Health Alliance and Environmental Health webinar series, and today we have an exciting group, Farm to School Salad Bars, Safe and Healthy Local Food. And with that, some of the things that we're hoping to achieve today is a presentation on the Riverside Unified School District Farmers Market Salad Bar Program by Rodney Taylor, Director of Nutrition Services with Riverside Unified School District and member of the California State Board of Food and Agriculture, and then comments on environmental health aspects of the program by Keith Jones, Deputy Director of the Riverside County Department of Environmental Health. But with that, I want to take just a moment and give you a background on both Rodney and Keith, our two speakers today. Rodney K. Taylor is a Director, as I mentioned, of Nutrition Services for Riverside Unified School District. He is a noted pioneer and expert in farm-to-school salad bars. He is particularly known for establishing the Farmers Market Salad Bar program in 1997 while working as a Director of Foods and Nutrition Services in the Santa Monica Malibu Unified School District. Rodney is a member of the California State Board of Food and Agriculture, the UC President's Advisory Commission for Agricultural and Natural Resources, and Network for Healthy California Executive Committee. He is the recipient of numerous honors and awards, including the California Endowment Health Heroes Award and recognition from Loma Linda University, the Riverside Human Relations Commission, and the NAACP. And we are just really fortunate to have Rodney, and he will be our first speaker. And following Rodney will be Keith Jones, who is, as I mentioned, the Deputy Director of Environmental Services for the Riverside County Department of Environmental Health. And he leads a division that is comprised of multiple county-wide environmental health programs. These programs are responsible for regulating retail food facilities, public recreational waters, organized camps, vector control, mobile home and RV parks, and retail tobacco with Riverside County. Keith's management philosophy is to protect the public health in a business-friendly manner through high-caliber personnel. Keith is a Southern California native and has an MBA from CSU San Bernardino. So with that, I'd like to turn over to Mina, who will be going over some of the call reminders.
Sure, just really briefly, I mentioned already we have muted all the lines, so if you do wish to speak, please press *6, which you can also use to unmute yourself. If you are just calling in and are not using Start Meeting to view the presentation, then you can download it from our website, which is phasocal.org. If you look at the blue banner at the top, all the way on the right, there's a link that says EH Call 3, and you can find the presentation there. This webinar is being recorded and will be available on our website. And that's all for me. Back to you, Gail.
With that, we will go ahead and welcome Rodney to tell us about Farm to School Salad Bars, Safe and Healthy. Go ahead, Rodney.
Good afternoon, everyone. My name is Rodney Taylor, and I'm the Director of Nutrition Services with the Riverside Unified School District. And Riverside Unified School District is the 15th largest school district in the state of California. We have an enrollment of 43,000 students in 47 schools, and our average daily participation of meals is 34,000 meals. 68% of our children come from at-risk homes, and that's an important figure for you to keep in mind as I get into the presentation, because what that's basically saying is we round up 7 in every 10 children in our district is at risk of hunger. And so when we started the salad bar back in 1997, in the Santa Monica Malibu School District. It was for the same reason that we started here in Riverside and why we continue with it. We want to provide access to children from at-risk families. And before I get into that, it's probably important that I give you a little perspective. The Farmers Market Salad Bar started in 1997. We had a parent whose name was Bob Gottlieb, and Bob had a daughter in this school, and at the time we had salad bars in 5 of our 15 schools, and he set up a meeting, and when he came in, he said he was delighted to hear that we had salad bars, but a little dismayed by the fact that his daughter wouldn't eat at the salad bar because she thought the lettuce was brown and the carrots seemed slimy or had the white film, and the celery would get brown. And so his question was, what if we bought from the local farmer's market? And I have to tell you that I thought this was just another affluent parent with a little too much time on his hands. I didn't think it would work, that kids wouldn't eat vegetables no matter what. But I had learned in Santa Monica, Malibu, there's a good reason why the affluent are affluent. They don't take no for an answer very well. And so we decided we'd do an experiment, and we'd do it for 2 weeks during the summer of 97. My feeling was it would fail. It was with the preschool kids. They wouldn't eat fresh fruits and vegetables, and I could move on with my life. Well, I walked in that first day, and what I found was his interpretation of what a salad bar could be, and I'll talk a little bit more about that in a minute. And anyway, I went through the line, and there were adults helping the kids, and I sat down with the kids and ate. And I have to tell you that when I walked out that day, I knew Bob was on to something. Although I didn't let him know about it at that time, we did go forward with funding from the California Nutrition Network grant, and we started the pilot program at McKinley Elementary School. And that was in 1997. By 2000, we had it fully institutionalized in all 15 schools, and the kids were eating it, and it was doing well, but everyone was saying to me, well, that's an affluent school district. That's the Republic of Santa Monica. They're different. And so in 2002, I left Santa Monica Malibu School District with one quest in mind. I wanted to go to another school district to implement the farmers market salad bar to prove the skeptics and the critics wrong. And so in 2005, actually in 2004, I got a call from that same parent, Bob Gottlieb, and his question was, are you ready? And I said, Bob, I don't even know where all my schools are yet. And so he said, you want me to call you back in a year? And I said, yes. So he called me back in a year, and his only question was, how much money will you need? And so we got funding to fund a salad bar coordinator, and in 2005 we began our pilot program at Jefferson Elementary School, a school of 1,000 students, and we served 900 meals. And in the first 2 weeks, we averaged 658 salad bar meals a day. We actually used all the salad products that we purchased for the week on the first day. We didn't know that kind of success in Santa Monica, where the highest number we had ever served a salad bar meal was 180, and here we are feeding 658. So, it answers some of the question, and that is, will kids eat healthy if provided healthy choices? And the answer is yes. And I'll give you proof of that down the road in my presentation. In Riverside, let me tell you that we're nationally and internationally known. We receive visitors from as far away as Japan, Canada, and New Mexico, agencies and organizations that are interested in providing their constituents with more fresh fruits and vegetables. And in 1997, the question was, well, would kids eat healthy? And the answer is yes, we have a national movement now. We've got Let's Move salad bars out of the White House. We've got USDA with their Farm to School website. We've got the National Farm to School Network, and at least a half dozen of universities who all specialize in some form of farm to school. Here in Riverside, we now have the Farmers Market Salad Bar in 30 of the 31 elementary schools. We've fed over 6 million salad bar meals. So the question is, will kids eat healthier provided access? The answer is yes. Can you modify eating behaviors? The answer is yes. And so let me talk a minute about the benefits of salad bars. For one, it provides an untapped market for small farmers, and it also has the added benefit of supporting small farmers in local agriculture and the local economic development. In 2005, we spent $10,000 on 3 farmers. Last year, we spent $300,000 on 9 farmers, and this year we'll spend over $400,000. Now, our overall budget for produce purchases is $1.4 million, so we would like to grow it till we're up around 80%. The problem that we have, we're a very large school district in that sense, so a small farmer cannot provide us with the 400 flats of strawberries we need, and that's why we have 9 farmers, and we're always looking to add more, but we think more regionally now. And regional for us is the state of California. We have abundance of products. We grow 450 products in California. So just about everything other than bananas and pineapple grow in California. So there's a plethora of items that traditionally you wouldn't find in schools that are available. We decreased the distance, so our carbon footprint is less. Of course, we're supporting agriculture and small business, and we're preserving local farmland. I was at a meeting yesterday with the UCD presidents, ag commissioners, and one of the commissioners made us aware of the fact that 310 acres of farmland is being taken out of production every year. And we have helped ensure that that doesn't happen, because in 2005, Farm to School in the Inland Empire was Riverside School District. One of our farmers who we started with back in 2005, Bob Knight, who you may be familiar with, now provides produce to 38 school districts in 4 counties, and they serve LA Unified, which is the second largest school district in the country, serving 640,000 meals a day, and San Diego, the second largest. So our small farmers have figured out how to develop informal hubs and to scale up to provide districts with the need that we have. And as I said before, we're preserving the farmland and we're reducing the carbon footprint. The other benefits that are near and dear to my heart is that we improve nutrition in our students. There's a study that's been done by the University of North Carolina at Chapel Hill, and you can find the report on our website where they did a 2-year study of the salad bar program and eating behaviors of children at the two sites, and 2 controlled sites and then the non-controlled site. And what they found is that one, that from a financial standpoint, the salad bar is revenue neutral, because the first thing everyone wants to know is how much does it cost, which in effect is the wrong question. We shouldn't be concerned with cost. We should be concerned with the health and well-being of our children. If in fact we were to start a business, we know that we have to make an investment in order to grow that business. The same is true for school food service. If we're going to change perceptions of school food, then we've got to make an investment. And what we found is by putting better food in schools, it didn't cost more. It increased participation, it reduced waste, and it increased revenue. It also is a tool in reducing hunger. I told you in Riverside, 68% of our children come from at-risk families. These kids they don't have fruit balls on their dining room table, I assure you. And so would a child have access to jicama or kiwi or fresh melons? I don't know that they would. And this gives them an opportunity to have access on a daily basis. We went a step further, and I'll talk a little bit about Salad Bar first in a second, but let me finish this out. We're fighting the childhood obesity epidemic. The experts told us in 97 children weren't eating enough fresh fruits and vegetables, and that was the key to combating obesity. And here we are in 2014, and we still have the same issues, and there's debate over whether or not we're winning the battle of obesity in the fight against obesity. But we do know this: we at least have mobilized a movement through farm to school, that now we have school districts that are only buying locally grown beef, hormone-free chicken. We've just started a whole food revolution. And no, it didn't come with Jamie Oliver. It actually started back in 97 with 3 school districts, Santa Monica, Malibu, Florida, and in Connecticut. And it just grew into something that none of us would have fathomed back then. We've been able to influence policymakers at the local and regional levels, and even at the national level. We have a farm-to-fork official in the Department of Agriculture in the state of California. And so we're making huge progress, especially in California, where, you know, I'd love to tell you that we did all of this on our own, but the fact of the matter is we were legislated in the good behavior through SB 19, SB 12, and 965 back in the 90s. But we built on that, and farm to school, we found out that there was a place for it in schools. And so other benefits is we're providing experiential learning for students. We take them to farms, to farmers market. We bring the chef in the classroom. We tie the cafeteria to the garden, to the classroom. We bring in our partners from here in Riverside, the Riverside County office, the Riverside County Office of the Riverside County Department of Public Health has been our partners from the beginning back in 2005, and through the Harvest of the Month and other collaborations that we've had, we've been able to make inroads in nutrition education, which you all know is just as important. Providing access alone is not enough. We need to educate children on making healthy choices. We need to educate their parents on how to make healthy choices, and staff as well. We need staff to model for the children. So with our Salad Bar program, we had programs where the teachers, if they came in and ate in the cafeteria, they were able to sit down with the children and eat with them as well. We've also had poster contests, which have been great. We make annual calendars with the kids, 5-a-day drawings and so forth. So I really like to touch upon the experiential learning, because I can recall as a kid making buttermilk in class and extracting butter. And for an inner city kid, I can tell you that of all the things I remember of my 13 years of school, I remember that, and that was in 3rd grade. So we think that we are providing those same things with kids, where they're learning the difference between a root vegetable and a tree fruit or what have you. It's so funny that many of our kids don't know what a peach is, a fresh peach is, until we describe the canned peach to them. or they didn't know where a potato grew or what a potato was until we told them about the French fry. So, and then there's cultural things about food that brings us all together. An African-American kid may not know what jicama is when the Latino kid can tell you that with a little chili and lime, we not only can spruce up that jicama that tastes like a sweet potato, but we can learn a little bit about each other's culture. So it's been an exciting time for us here in Riverside. And you might ask, what do kids like about the salad bar? Of course, they learn that unlike they're taught by the store, where we can go in a store and basically find fruit year-round, they're finding that, one, fruit is seasonal. We teach them about that. That's what's offered. It's offered in season. Many times our farmers deliver within 48 hours of it being picked. So what do our kids receive? We receive fruit at the peak of its growing season. And if you've ever gone to the local farmer's market and had a plum, I don't need to tell you that the difference in that plum and one that we might get in the supermarket is very, very different. And so I like to say that the farmer's market salad bar or salad bars appeal to the senses. First, we buy with our eyes, so it's colorful, as you see in the picture here, that it's pleasing to the eye. You might note that it's cut up, so it's user-friendly. One of the things I've learned in all my years working with the salad bar is that we've always had fresh fruits and vegetables in school, but we're giving a third grader an apple, and a third grader doesn't even have teeth, so they can't even bite into the apple, and we wonder why they go in trash. Or we give a kindergartner an orange, and here I am at 59, I can't peel an orange. And so, you know, we haven't looked at why we've done things traditionally and asked ourselves, you know, why doesn't it work? So what I've learned is that it has to be user-friendly. And think of it this way. If you were in a meeting and I set a bowl of fruit in the middle of the table, chances are we wouldn't eat very much of it. But if I put a platter of chopped fruits in there, you'd probably eat the whole thing. It's just easy to do. And it's that same concept. And then it's pleasing to the eye. It's pleasing to the taste. And then we are able to offer the kids variety. And you'd be surprised. The items that kids most like, that are most popular, are strawberries, grapes, they like raisins, they like cucumbers, they like carrots, and they're enjoying all of these items. Let's talk for a minute about the impact on public health. There certainly is compelling evidence, and there's been many research now that a diet rich in fresh fruits and vegetables can lower heart disease, stroke, blood pressure, cancer, and so on. And so even if I were to tell you that the salad bar costs more, I would tell you that it's my responsibility as a nutrition service director, where intervention is so much easier in the school because we have the ability to feed kids breakfast, lunch, supper, a snack, summer schools, Saturday schools, weekend. A school district, in my mind, can serve as a catalyst for change in the community, and we are very involved in the community with our partners, again, at the Department of Public Health, with the hospitals and other agencies that are concerned with families at risk. So that's important. The nutrients in fresh fruits and vegetables, I don't need to tell you, is far more beneficial than if they were drinking juices or eating canned fruits and vegetables. So locally grown is just full of flavor, and kids learn about texture and appearance and taste. They learn that an apple is not like an apple in the store. They're shiny and polished with wax, that they do have blemishes and they're not perfect. And that's great for the farmers because with our citrus farmers, what we were finding is that they couldn't find a market for their oranges because they weren't large enough for the stores. So they would sit on the tree or fall to the ground and die, when in fact they could sell a smaller orange to us because we were cutting ours up, and it's based on what the kids take as a whole, not that they have the whole fruit. And our belief was that even though we're required to offer a fruit and vegetable, why should a kid be constricted to one fruit or vegetables? We teach them to eat the colors. We now have what we call salad bar first, where every kid goes through the salad bar first. There's an adult on each side of the salad bar that's engaging and encouraging kids to eat the colors. And when they get through the line, they get a little sticker that says, "I have a rainbow in my tummy." And that may not be very cool to all of you, but that makes me awfully cool in the school district. And so we're finding ways to have fun, to encourage good, healthy eating behaviors. And I have to tell you, we haven't had a lot of conversation about health. I think that turns people off in some cases. We always say that food should be kid-proof, and we should take it to the kids and let them tell us. But when we take it to them, we're giving them a choice of healthy and healthy. There's no chips or cookies or all that stuff that has empty calories. If we go to the next slide, what I'd like you to see, and this will wrap up my presentation, is a salad bar should be pleasing to the eye, pleasing to the taste. It should be user-friendly. It should offer kids choices. And as you see in the picture, the kids will make healthy choices when provided access to those choices on a daily basis. And so we not only have the salad bar, we made a commitment 2 years ago to only serve fresh fruits and vegetables in our district. We serve no frozen and no canned fruits and vegetables. That was an expensive proposition, but it's been healthy for the children and healthy for our bottom line. So those that would question whether the kids waste a lot of fresh fruits and vegetables, I can tell you in Santa Monica, we learned that we were able to reduce our food costs from 70% to 58%, which paid for the additional work that was involved in terms of preparation, because we do all the cutting and cleaning. So when people say it's more work, it created 28 jobs in our district, added more hours for people there. We grew our revenue over a 7-year period, and this is probably, at least when you're talking to people in school food service, I can tell you that we grew our revenue at $1 million a year for 7 consecutive years while we were building our salad bar. We increased participation from 47% in 2002 when I came onto the district to now we feed 70%. So the question is, will salad bars modify eating behaviors? Will it make our children healthier? Can we reverse the tide of obesity? I would argue that we're already doing it, not only in Riverside, in California, and across the country. Thank you very much. Oh, excuse me. I probably, would you move on to the next slide? I forgot I had another slide after that.
Sure, gladly.
So,
you have a couple others too. I don't know if you want to keep going, or we can have them as reference during the discussion.
I've already went over this one, so if we'll move to the next one, this is what I really wanted to show. So if you was this whimsical what we did, this was a chart that was the University of North Carolina at the Center for Health and Promotion and Disease Prevention helped put together this model of how is it that the salad bar works, what were our goals, what were the activities and outputs we were looking for, short-term, intermediate, and long-term, and how are we going to impact the children, and what does it take? And I have to leave you with this. Nothing is done in a vacuum. I would love to tell you that I'm a salad bar expert. I am not. I have wonderful partners. and you see some of the names up here of the organizations, but that list is not exhaustive. It's just a example of what it takes to build a program like this, and more importantly, how do you sustain it over the years? How do you keep it fresh? How do you reintroduce it to the children? How do you continue to make the impacts? And how do you put healthier food into schools, change the perception of what parents have of school food so that they trust us and send their kids to school? And then how do you serve as a catalyst in the community for change and change perceptions about school food service? And I actually answer all of those the questions that I asked on the next page. And with that, that does conclude my presentation. So I'll be looking forward to questions.
Thank you, Rodney. I would
you.
like to bring Keith on, and how, Keith, you have worked with Rodney to with the salad bar program.
Okay, this is Keith. Could I get a confirmation on the phone that everyone can hear me?
Yep.
Yes.
Fantastic. Okay, well, thank you for inviting me to speak today. Rodney's the real star of the show today, but I was asked to do a brief comment on the environmental health perspective of this great program, and I'm sure there's a few other environmental health directors on the phone across the state that can chime in during the open discussion. But just let me say a few things here. I have attended all of these Public Health Alliance conference calls, I believe, to date this spring, and I think it's a great opportunity for the folks in public health and environmental health professions to better understand and respect each other's perspectives and try to reach some common ground and leverages for the benefit of the community, because we each have our specific roles, but we also have some common goals here. And I think this topic today on the salad bars at the schools is a great opportunity to talk about that. Public health nutritionists may love the salad bar idea, whereas your typical environmental health specialist might actually cringe when one of their regulated food facilities roll out a new salad bar or buffet line in the restaurant or the food facility. The reason for that is anytime you have a salad bar or a buffet line out of the actual kitchen in the area that the consumers can access, there's typically more chance for contamination. So it's a big responsibility to successfully run this type of operation. I was going over the notes here in Rodney's program, and I thought, wow, 2005. I was a supervisor in this office back at that time, and I can't tell you for sure I was directly involved as an early partner. I wish I could say that I was, but I know Rodney's worked with a lot of different folks putting this thing together. I know we routinely conduct inspection in all of his schools, as in all of the public and private schools in Riverside County, and we have for many years. So as opportunities come up, we try to communicate, educate, and work together for success in food safety. But to be honest, the first time I heard about Rodney's program was about a year and a half ago when Riverside County Environmental Health had volunteered to coordinate and host the S3 Food Systems Conference. And Steve Van Stockham, our director, and I had had a meeting with our county ag commissioner, and he gave us a lot of good tips on who we should try to tap to have some good speakers for the S3 conference. And one of the first ones was Rodney, and they said, we have a rock star amongst us here, and everybody wants to hear about what he's doing with the schools and the salad bars. So that's actually the first time I remember hearing about it. I'm not going to try to, blow smoke at anybody here and say that I was an early partner in this, but I'm sure over the years we've communicated and again, try to work towards the common goal. When I talked to Ron Bray, our Deputy Ag Commissioner, last week after I was asked to participate today, I asked Ron, I said, hey, Ron, what's your involvement been? And let me just read a brief email response I got from Ron Bray. He says that they're not directly involved with the RUSD Farm to School program, but from their perspective, The program is simply a buyer-supplier relationship controlled by private contract. The growers are not required to register or be certified by the Ag Commissioner in order to participate. The growers are subject to the same regulations, meaning pesticide use, worker safety, quality, maturity, packaging, and labeling, as a grower who might sell to a large retailer or an ag cooperative. I know that Yolo County Ag Commissioner's Office has worked very closely with their school district in forming a similar program, and he provides a contact name for Yolo County of Nicole Sturzenberger. I have a phone number and an email for Nicole if anybody would like that later on. So it's another one of those issues where, we're talking about maybe the source of foods, an approved source. And I know there's been some recent legislation and some pending legislation talking about the approved source issue. A lot of times, the Ag Commissioner may expect environmental health is going to deal with an issue, or we may expect the Ag Commissioner is going to deal with it. So that's what we're trying to do here recently, is sort out some of these issues and try to all work together and talk amongst ourselves to make sure that they're all being properly addressed. Some of the reasons for the approved source issue is to have some traceability. Heaven forbid somebody gets sick eating some fresh produce off the salad bar. You want to know where you got that so you can go back to that specific farm and we can pinpoint it and try to prevent additional illnesses. As far as salad bars or buffet lines go in general, environmental health departments are typically involved with plan checking and expansion to an operation. We would look at things like the type of equipment that's going to be used, making sure that there's the sneeze guard, which is a big part of a salad bar operation, trying to prevent that contamination from the customer, use of tongs, the placement of the salad bar. Like I said, it's not going to be inside the kitchen. It's going to be out there where the customers are, the diners are, but that doesn't mean that we want it right next to an entry or exit doorway where you have more potential for contamination with dust and insects. And then the procedures. Rodney mentioned about the monitoring of the salad bars. Very important. You want to have, especially with these school-age children and their sweet little grubby fingers, you don't want them touching everything. And even though the sneeze guard is a standard requirement, they're not always designed for those youngsters that are short, and a lot of times are right down there below the standard sneeze guard. So those are things to think about. Nutrition is a fantastic issue, and that's what we're talking about here, fighting chronic illness. But traditionally, environmental health is looking at food safety and trying to stop that food from being contaminated and stop the consumers from becoming ill with a foodborne illness. So we talked about approved source. We talked about protection from contamination. That's pretty much what I have at this point, so I'll go ahead and turn that back over.
Thank you, Keith. Tracy?
Hi there. This is Tracy Delaney. I'm with the Public Health Alliance, and I want to thank both speakers for wonderful presentations. Rodney, I had heard that you were humorous and charismatic, and that is definitely true. And Keith, thank you so much for kind of getting to the nut of the issue that we're struggling with, which is how can we bridge some of the regulation and expand some of the healthy choices that are going on. So I think what I would like to do, I know I have a few questions, but I think I'd really like to open it up to the folks on the phone for any questions or comments or ways that we can kind of move this discussion forward so that we can emulate some of the great work that's happening there at Riverside Unified. So if you do have a question or a comment, please use *6, and we'll take questions for our presenters. Thank you.
Tracy, this is Angelo Balomo.
Hi, Angelo.
Hi. I just wanted to say I thought both Keith and Rodney gave excellent presentations, and I think together this is really sort of sets the stage for some discussion. I think the question I had mainly for both Keith and Rodney is what have you found to be the structural impediments to installing salad bars in schools? I understand that some schools have gone out of real food preparation for a number of years, and how bad is it in the school districts, at least within the areas they're familiar, to ensure they have the basic structural requirements to run a salad bar?
I think I'll address that first because it's a question that's come up across the country with regard to salad bars, because every school district is different. There's no one size fits all. Even within a school district, we have 30 schools, 31 elementary schools that have been built over, 60, 70, 80 years. And so you have some school districts in California that don't even build multi-purpose rooms, or the kitchen is very abbreviated. So how do you present a salad bar in these environments? And what we found, not only in Santa Monica, but here in Riverside, that in most cases, if there's a will, there's a way. The one thing that we backed off from is we won't put them near doors, or we won't even consider anything outside. It should be inside. It should be, the salad bars are in the multi-purpose room. They're located near the refrigeration. We add refrigerators so that the food is kept, the replacement products could be kept right in the refrigerator until they're needed to replenish, ensuring that you have units to keep it cold. But now the other question that you're alluding to is, what about all the prep that goes into it? Well, here in our district, we go from everything from there's schools that do the majority of their own prep to the majority of the prep being done in our central kitchen. Some districts have central kitchens and some don't. So that's the assessment that quite often you have to do first and foremost when you're interested in it, is asking yourself about the infrastructure, how would it look, and it's not going to look the same in every school site. And that's from a logistical and operational standpoint. Keith may want to chime in as well.
Yeah, I don't really have anything to add, Angelo. I haven't been had it brought to my attention that we've run up against any real issues or problems, but I definitely understand where you're coming from. Like I said, anytime an existing facility wants to expand and add another part of an operation, you have to kind of take a step back and see what's involved, whether you need any kind of additional prep sinks, refrigeration, so forth. But as Rodney said, we have a mixture here in Riverside County and in the city of a central kitchen where they do a lot of prep and maybe just ship out the containers of the pre-prep food to be used, and then we have a few schools that actually do still some prepping on site. So that's one thing that our staff would look for, of course, if they are contacted or they happen to show up and find something different, to say, okay, where was this prepared? How are things being cleaned, and so forth.
Thanks, Keith.
This is Tracy. I have a question as well. I was, wondering, Keith, when you were talking, you said a lot of times environmental health directors will hear about salad bars and they cringe. And so I'm wondering if both our speakers could maybe address that. You were talking about, dirty hands. What are some of the procedures that you put in place that assure you that you are taking into account the food safety?
Keith, if you don't mind, I'll address that as well, because these are very good questions, and they're the questions that I've been hearing for 17 years. And we still have those that are skeptical or critical or just uncertain. And there's always this fear that kids are going to contaminate the food, or they're runny noses and all of this stuff. And so what do we do when we wanted to start a salad bar? We would contact the principal. first and foremost, go over all the issues with the principal, the logistics and everything. We then have an assembly where each classroom would come into the multi-purpose room where we'd have an abbreviated salad bar set up. We would have already given the teachers the salad bar etiquette, the instructions for children on how to use the salad bar, and they would go over them in class. The purpose of the assembly and the abbreviated salad bar was to get the kindergartners to use tongs, to get kids to understand that when they dropped something on the floor, they left it there. We were there to get it up. That if they spilled food on the tray rail, they left it there. Our people are there to clean it up. That they never put the whole utensil back into the holding container because their hands were on it. They're taught to wash their hands, and at the beginning of the line we have a sanitizer. So I like to say to you that, I've served over 6 million salad bar meals, and I haven't lost a child yet, and yet I still get people saying that doesn't mean you won't. Our food is as safe as anywhere that you can buy food. I've been to USDA's Produce University, well-versed in how to go out to farms and what to look for to ensure that animals aren't, in areas where food is being grown, looking for runoffs from where maybe, whatever might be running into the fields where produce is grown. And then, of course, with our HACCP standards, we know the critical control points, as Keith alluded to. We're going to make sure that when we buy from a farmer that we teach them a little bit about GAP. We don't require GAP insurance, which is GAP is good agricultural procedures in how food is handled from the time it's harvested until it's brought to our facility. At that time, we're using our HACCP training that we've received throughout the years and go revisit every year to ensure that the food that we present to the 40,000 students in this district is not going to place the children at risk. So that's just a snapshot of some of the things that we do to ensure it.
This is San Diego County. We just had a question about the farm site itself. Does Riverside Unified School District representatives go out to the site to verify that there's no issues as far as cross-contamination?
Yes, we do. I have a full-time salad bar coordinator who orders the products. She actually receives orders from the schools, comprises those orders, calls them to the farmers who deliver to us twice a week. We go out more than periodically. We may go out periodically to check, but we're also often there just through farm tours. We bring farmers in the classroom to educate the children and even to train our people on how to handle the produce that we buy and how do you get the optimum shelf life out of it, whether tomatoes should be refrigerated or not refrigerated, and so on. But more importantly, we are out there making sure that I would tell you that the products that we buy from the small farmer, we have greater assurance than when we're getting products from other parts of the world, whether it be Honduras, Mexico, or wherever. Not to say that food's unsafe, but you better believe before we serve something to our children, we feel real good about what we're doing, that we're not putting them in harm's way.
Thank you.
This is Keith. Rodney, would you please maybe briefly describe to the audience the typical types of food items you have on there?
Oh, yes. If you go through the salad bar, as you saw in the picture, the first you're going to run across is the lettuce. And notice it wasn't the shredded lettuce, that it was colorful. it's going to have some red cabbage, and it's going to have some romaine, and depending on what other lettuces, what time of the year it might be, the butter lettuce. It's an excellent opportunity for us to teach children about the varieties of everything. I can't even tell you how much I've learned about the number of varieties of apples and everything else. So we're not only able to offer food that's great in season, but we're able, because we're in California, to offer such a bounty and then to teach children about that bounty. And I'm not sure whether I fully answered your question or not. So if I didn't, let me know.
I was just wondering if there was anything that would be more potentially hazardous foods. Of course, once you start chopping up some fruits and vegetables, then it adds risk over the whole fruits and vegetables. But I don't believe that you're offering any kind of dairy or animal origin type foods.
Right. Well, initially we did all put the salad bar. What makes ours unique from any other school district is it's a complete meal in Riverside, meaning that when a kid goes through, we have to offer 5 components from the various food groups: the bread, the dairy, the grain, the fruit and vegetable. And on the salad bar, all 5 of those items are offered. So when you go through the line, there's the lettuce, and it might be followed with tomatoes, and then cauliflower, and then cucumbers. It may have broccoli or so forth, depending on what's in season. And then you get into the proteins, and that might be yogurt. To answer your question, cottage cheese. It could be eggs. It could be peanut butter. It could be tuna. And then we also offer the fresh fruits in season, and that could be, if it's summer, it's the melons and what have you. Probably the 2 items that you will never find on our salad bar, which place kids at that age range at risk, are the sprouts. Whether it's we just don't do the alfalfa sprouts or the bean sprouts because of the and I don't want to demonize food, so I don't want to give any impression that I have problems with those foods. I eat those, but the experts tell us that with this age range, it could place them at risk, that they're more susceptible to maybe germs or bacteria, so therefore we stay away from those. What's most important is how we treat the melons and oranges and apples once we receive them. We talk about processing the vegetables when they get to us, and processing is just simply how we might clean them before we use them.
Now, this is Keith again. I'm glad you mentioned that, and thank you for the explanation. That's one of the areas in the Health and Safety Code. The California Retail Food Code specifically says that you cannot serve certain foods such as raw seed sprouts, unpasteurized juices, and so forth to licensed healthcare facilities or public or private schools. So that one is outlined in black and white for us. And I know we have not seen any problems with Riverside Unified. Going back to the items on the salad bar that include the potentially hazardous foods, in Riverside County, for decades we have had a food handler certification program in place long before it became state law. So that's one of the things that we hope all the food service workers out there key in on, that's an increased risk having those types of foods out there in the salad bar, needing temperature control as well as protection from contamination.
And that's very important because prior to coming to Riverside, and I've been in school districts now over 24 years, been here for 12 of those years. I've been in 9 school districts. This was the first school district I came into, and inspections were routinely done. For whatever reason in Los Angeles County, and due to budget cuts and all of those things we know about, we would only receive an inspection when there was a complaint. I come here to Riverside, and before the law, we were getting evaluated all the time. And I have to tell you a cute little story. One of my operation managers come in one day and says, we got an 85 on our health inspection at this school. And I said, well, 85 is a B anywhere, and that's pretty good. And they said, not in Riverside. In our school district, we expect 95 or higher. We reward our facilities, as does the health department, recognizes the schools that receive 95 or above on their 2 scheduled inspections, and that is the standard that our district goes by. My hat is off to the Riverside County because I've never seen an area that had been so strict, and it held us to a higher standard, and it taught us to hold ourselves to a higher standard.
It looks like we have time probably for one more question. Is there a question in the audience or comment?
Then if there isn't, I think what I'd like to do real quick is give kudos to San Diego, because San Diego County has probably doing the greatest job of farm to school. They've kind of overtaken our efforts in the Inland Empire with the work they're doing with San Diego Unified and the other school districts that are interested in farm to school, and the county's very involved in that. And Yolo County, with Mr. Young up there, the Ag Commissioner taking the lead, showing that even the county could be the catalyst for change in a community. And, the city of Riverside just had their Grow Riverside conference, and the city is taking the lead. So we don't always have to look for schools or individual agencies, these partnerships. There's a grant that the Riverside Department of Public Health entered into. They granted funds to the city, who subcontracted to the 2 school districts, and it's created a synergy in our community that has us aspiring to greater things. So the excitement of talking with you folks is, as you already know, it's not only partnerships, it's those unconventional partnerships that let us move across areas that traditionally boundaries that we wouldn't cross, and we're having greater impact in bringing about change in the community. So I thank you for being able to participate in this forum.
Well, thank you so much. I think we have a lot that we're learning. It's great to see these best practices, and we hope that you might be available if we have some follow-up questions that might come from our group
Sure.
after your presentation. But we really want to thank you, and we would like to thank everybody who joined us on this call and in our continuing dialogue that we're having. And I'd like to invite you to join us again next month for our next call, which will be May 20th. Again, same bat channel from 2 to 3 o'clock. And thank you again for your participation and for your collaboration. And thank you to our presenters.
All right. Take care. Bye-bye.
Bye-bye.